So the strategic plan over the next several years is very exciting to us. So what we're going to begin doing is building out some satellite clinics, particularly in areas that are underserved. In addition, what we're doing is we're going to begin a program for adolescents. One of the things that we need in the community are intensive outpatient services. From my point of view, it's the only way to address the high number of Baker Acts. What happens with Baker Acts is that clinicians, if they don't have intensive resources to help manage children in crisis, they will put them in the hospital because there's nothing else we can do. We feel very confident that we can reduce probably by 50% the number of Baker Acts if we begin to increase the quality and the number of intensive outpatient services. We're also going to begin to stand up an autism testing center with our colleagues at the University of Rochester. They've done some very good work. We're going to partner with them to stand that up. We're going to expand our Care Navigator program in the schools. What we're learning even, more these days is that the earlier you catch any kind of illness, whether it's physical or mental or any kind of illness, you reduce the likelihood that it'll become more severe. You reduce the amount of time that it takes people to recover. And you also begin to build skills that help people learn how to cope earlier on so that they don't suffer as much and they don't arrive into adulthood being symptomatic and more dysfunctional.
So we've done quite a bit with the dollars raised, and many of you have heard me talk about the 1,000+% increase in the number of available visits, but it's not enough. And so our goal is to continue to bring providers from outside of Southwest Florida into Southwest Florida, growing our capacity and our capability to care for these children. At the Children's Hospital, because of your support, we currently employ 3 pediatric psychiatrists. We have been blessed in our ability to hire several pediatric psychologists, licensed mental health counselors, mental health therapists, licensed clinical social workers. And that work is going to continue. And we are going to distribute these providers into the communities where these children live. So children don't have to drive from Lehigh all the way to Golisano Children's Hospital. They don't have to drive from Immokalee all the way to Golisano Children's Hospital. Many of the children that we care for are underserved. And so driving, that's something that we take for granted. It's a luxury. And so if we put our providers in their community close to where they live, the likelihood that they're going to come to their appointments is higher. The likelihood that their families will participate in family therapy is higher. And so with your dollars and with your support, we are going to bring pediatric mental and behavioral health specialists to the community where these children need it most.
We need to do a lot more lobbying. We have to get the federal government and the state government to reimburse appropriately for mental health services so that more families can access our services. So we need to lobby, we need to work together as a community. We need to launch additional community programs, things like Normal is Overrated or our Visuality partnership or our partnership with arts organizations. We need to destigmatize mental illness. We need to have this out in the open. We need to get families the help that they need. So the investment that people are making in Kids Minds Matter really enable us to go out into our community, to build our provider network, to share this, and to get children the help where and when they need it.